Hello, everyone. Welcome to a new episode of Small Talk, a conversation on health and healthcare issues. Last weekend, RNAO had an important part in a rally against Bill 124 in Ontario. This event was widely covered by the media, and the message RNAO wanted to put out was very clear: repeal Bill 124. I am your host, Raul Pinto, and today I'm happy to have Madison Scaini from RNAO's communication department. How are you today, Madison?
I'm doing great. How are you?
I'm good, thanks. And I'm glad that you could attend the rally. So you were there, right? It was raining, it was cold, but people seem to be very excited to be there. Can you tell us about that?
Yeah, well, it was a very, very cold, rainy day. At one point, I couldn't feel my fingers or toes, but we were there. And honestly, it was very symbolic. Nurses showing up, and nurses, but also supporters. We had nursing students whose partners showed up, as well as doctors in support of nurses, teachers in support of nurses, other healthcare professionals. It was very, very powerful. But the cold, rainy day was very symbolic that nurses show up no matter what. And I'm not a nurse, but I am so proud to be a part of an association that works with nurses and advocates alongside nurses. Because they show up, good times and bads, and at the end of the day, it's for us, it's for our health. And so, despite the cold, rainy weather, it was a very, very important and powerful day that showed that nurses care. So it was fantastic.
And what do you think about the fact that RNAO is an association that not only wants to reach, of course, a registered nurse and NPs, and everyone in the healthcare system, but also the public, to make them understand that the issues the healthcare providers have are not only close to them, but it's something that everybody should know about.
Yeah, well, I think this goes back to day one when we were cheering for health workers and calling them heroes, and enough's enough. And the public needs to know why. Nurses don't want to be called heroes anymore because they're still showing up to work throughout the pandemic. We're into what, fourth, fifth, sixth wave now. And it's important that the public understands what the experience really is like on the front lines. And it's not enough to say, they've been tackling the pandemic, they've been battling on the front lines. No, they've been caring for your brother, your sister, your mom, your dad, your friend, your neighbor, and people that you don't even know their names, but they have been there supporting them. And so something like Bill 124, they deserve respect and dignity for what they're doing. And the public needs to understand why. And so going past those and having those tough conversations, and that's what we were doing on Sunday. We were having tough conversations, and I was speaking with nurses who are so outraged, but also so passionate about there being changes, not just for themselves, but for other public sector workers. And that's what's so important, that even though this is an issue that is directly impacting nurses, they're still thinking about others and still thinking about how when they're treated better, they can provide better care and have better, living conditions and such, so then they could show up to work. And that's what it's about at the end of the day. It's about healthcare for all and improved outcomes for all. And so that impacts the public, it impacts Ontarians, it impacts Canadians, and that just ripples. And when we have better healthcare, it becomes kind of I don't like this. So when we have better healthcare, we can become a inspiration for healthcare across the globe. And so Bill 124 and the rally on Sunday, it's more than just about nurses. It's about the health of us all, and it's important for the public to know that.
Perfect. And we are in the month number 22 of the pandemic in Canada, right? How did you feel to finally see people in person?
It was strange. It was really, really strange, because not only was I seeing people that I work with, at RNAO, but many nurses that I've spoken with virtually, which I'm so grateful that I've been able to, and that we have the means to do so. And Sunday, it was a different experience for me, especially because a lot of these nurses I was meeting for the first time, but it was also, I wish that this wasn't the reason that we came together. I wish that I could have got to see them either at our AGM or at an assembly meeting or something more exciting, more celebrating nursing in a different way. So coming together at the rally, it was great to see everyone, but I wish we didn't have to get together for this reason. And the turnout was fantastic, and I felt very safe there. Being surrounded by a bunch of nurses and healthcare professionals, and it was very comforting to be surrounded by such passionate people. And we've been saying from the start of the pandemic, nurses speak out, and we have such a strong voice. And Sunday really showed that, because it's not just a virtual voice anymore. I heard the yells, I heard the passion, I heard the interviews. It was so incredible to be part of that, and to really hear the first accounts from a number of people. And like I said, it wasn't just nurses, it's all the supporters too. So it was different and strange, but it was really great.
Thanks, Madison. I will invite you now to watch some clips of the event, including speeches from RNAO CEO Doris Greenspoon, RNAO President Morgan Hofford, and other speakers at the event.
With the fear that entails, with the expertise that they provide every day, and with the compassion, because families couldn't be there, so the compassion that is required. What do they get in lieu of that? A slap in the face. Bill 124 is a slap in the face for nurses.
We do make good money. I'm not saying we don't, but we don't make what we are worth. And a 1% wage increase during a pandemic, with Doug Ford calling us heroes every time he's on TV, is demoralizing.
We're always working short-staffed. A lot of times I want to sit with my patient and be able to, provide that emotional support, but I just don't have the time.
We are on the verge of a healthcare crisis in Ontario. If we don't repeal this bill, we are at risk of losing a significant number of healthcare providers. So we really are at risk of losing vital healthcare providers, and without them, our healthcare system will collapse.
Morgan. This has been Small Talk. Thanks everyone for liking, for sharing, and commenting in our videos. Before we finish, Madison, I would like you to talk a little bit about In the Loop. It's a very special project. We know the communications departments have plenty of material every single day for everyone in our social media and in our website. But In the Loop is a special project in your heart. Can you tell us a little bit about that?
Yeah, so In the Loop is an exclusive member benefit. It's an e-newsletter that shows up in members' email inboxes on the last day of every month. And it provides a recap of all of RNAO's work and activities from the last month, as well as upcoming events and things to look forward to. It's separated into different categories, either so if your interest falls in our VPG department or our policy work, or just upcoming member promotions, there's something for everyone. So I encourage you to look out for it in your inbox, and send us your feedback as well. We're always open to ideas, and it's for you. So let us know.
Thank you so much, and thank you everyone for watching Small Talk today. See you next week.